ICSI is a procedure where a single sperm is injected into each egg using a microscopic needle. This is done in situations where the sperm is so abnormal that it typically doesn't have the capacity to fertilize the egg by itself. ICSI is actually very effective. The fertilization rate with ICSI is approximately 75%, which means that of the eggs that are injected with a single sperm, typically approximately 75% of the eggs will result in successful fertilization. Beyond that, the embryos will then develop. And if there are embryos that are transferred, the likelihood of embryo implantation with embryos that were created with ICSI is very similar to the implantation rate of embryos that were created with the regular IVF method. Now, ultimately, the likelihood of implantation of the embryos created with ICSI is dependent on the age of the woman who's providing the eggs. We know that the younger the woman who's providing the eggs, the more likely the embryos are to implant to result in pregnancy, and the older the woman, the less likely the embryos are to implant.